Dr. Isioma Okolo is a gynecologist, and she is a passionate, campaigner on this subject, and she's going to enlighten us about this. This is based on the fact that 41% of black women are more likely to develop cervical cancer than white women, and they are 75% more likely to die from it, according to the national. Okay, according to the
Okay,
National
that's
Institute.
good.
Yeah, I
Yeah,
think we do have Dr. Isioma Okolo. I think Jambo Radio is fast becoming another second office for you, Dr. Isioma, because of your expertise. I think, but we are glad that you're able to join us now. I think, am I right to think that you are joining us from Boston?
Yes, that's correct. So it's quite early for me, but that's okay. That's
I,
okay.
I appreciate that. Thank you very much. What time is it then now, just for curiosity?
It's 6:30. 6:30.
Wow, that's an early start.
Yeah.
Thank you very much.
Yeah.
As you know, yeah,
Mm-hmm.
but you're
That's
based
okay.
here in Scotland, so but you're in Boston for other
Mm-hmm.
professional work. Now, so let's start by perhaps you should tell us what cervical cancer is, and I've just talked about
Mm-hmm.
from your field of specialism, you're a gynecologist and you work
Mm-hmm.
with a lot of women. What is cervical cancer and what are the symptoms? Good morning.
Mm-hmm. Yeah, good morning. Thank you again for having me, George. Always good to see you. So, cervical cancer is cancer affecting the neck of the womb, also called the cervix. So, it's the entrance into the birth canal. And, globally, unfortunately, it's not an uncommon cancer. Specifically in Scotland, thankfully, the rates of cervical cancer are going down. What's important to say is no woman should ever die of cervical cancer because this is a condition that is preventable and treatable if caught early. So, how does cervical cancer tend to present? In Scotland, majority of people that present with cervical cancer, it will actually be picked up either because you have a change in your menstrual bleeding or you have vaginal discharge that is abnormal. What does this mean, right? So, if you have normal discharge can be kind of clear or maybe a bit white. Anything that's any other color of the rainbow, you should be worried and you should absolutely go and seek medical advice. Another presentation of cervical cancer could be changes in your bladder or bowel function. So, particularly if you notice when you're peeing, it's painful when you're peeing, it's stinging, you notice blood in your urine, if you notice any changes in your bowel habit, diarrhea, constipation, or even like bleeding in your stools, this is abnormal. Pain during intercourse as well can be a symptom, but often you would classically get bleeding. So this is the commoner symptoms. Some people it's just picked up incidentally when they go for their cervical screening as well.
Okay, and can you tell what are the main causes of
Mhm.
cervical cancer?
Yeah, so cervical cancer, majority of cancers are caused by this virus called the human papilloma virus. It causes more than 95% of cervical cancers. And this is a very common virus. Most of us, by the time we reach the age 60, about two-thirds of us would have been exposed to HPV.
Is
And
that both
contact
men?
with
Is
HPV,
that all gender?
all
Okay.
genders, and this is because it's a very common virus, and it is for most of us our body will actually get rid of the virus, we will clear it, but for a small amount of us, unfortunately, this virus will cause changes in the cell structure around the cervix inside the vagina. It can also cause other types of virus, other types of cancers, so for example throat cancer, and the lot, but changes that can then lead to cancer. So you get normal cervix, then a pre-cancerous stage, and then eventually cancer. Now, George, what's really important to acknowledge is that thankfully in Scotland, the rates of cervical cancer are on the decline. However, in Black women, what we see is the Black women are more likely to be diagnosed with a later, more advanced stage of cervical cancer. Screening is the number one toolkit we have to prevent it, screening and then the vaccination. So most people living in Scotland, if you're in school age, will get offered the HPV vaccination. And this is giving to school age children, girls at the moment, in some areas, boys as well. And this really can significantly reduce your risk of developing cervical cancer. And also, if you are exposed to the virus, you're more likely to fight it off. So, screening is the number one defense. Then the next, sorry, not screening, vaccination. The next defense is the screening. So, here in Scotland, the screening age is from age 25 to 64. And this this is important regardless of whether or not you are sexually active. You have to go for your cervical cancer screening. This is offered every 5 years. And what does it involve? It involves going to the GP or seeing a practice nurse, having an internal examination with a speculum, where we very gently have a look and obtain a specimen that's then sent off to the labs to check for whether you have this HPV virus. Now, we've changed the way we screen over the years. So now we're focusing initially on whether or not you have HPV virus or not. If you then are found to have HPV virus, you will then be invited to have further testing, and you may then have more frequent testing. But for most of us, you will come back with HPV negative, and what that means is then you get your screen every 5 years, and that should be protective for most people.
And what are the warning signs of cervical cancer if anyone would perhaps suspecting?
Yeah, so I think the key warning sign would be any abnormal bleeding. So, if you have a regular menstrual bleeding, regular periods every month or every couple of months, and you notice a change, that should be a key warning sign. So, heavier bleeding, bleeding in between your periods. If you have bleeding after intercourse, this is very important to report. Pain during intercourse as well, bleeding in your urine or in your bowels, any unexplained weight loss. These are the kinds of symptoms. And actually, when you look at the data on cervical cancer, there's really three reasons people are more likely to get cervical cancer. There's three delays. Number one, delay in deciding to go get screened, delay in actually getting the screening, and then actually when you physically are there to be screened, delay in actually accessing care. So the decision making, first of all, this is the most important thing I want people to go away with. When you receive your screening invitation from the GP, book that appointment and go and see your GP. Because currently, right now in the UK, every day, 2 women in the UK die from cervical cancer, and the test only takes 5 minutes.
Wow.
And this test can literally stop cervical cancer before it starts. Cervical cancer, nobody should ever die of cervical cancer. Even if you've had your HPV vaccine, you have to go for the test. And the test is a very easy test. It's much quicker than, for example, some people may people often will go and get like waxed and things like that. Much easier, much quicker, and this could literally save your life. So don't delay, absolutely go and see. Many women within our communities are scared. They're scared about the pain. They're scared about the invasiveness, and you can take things at your own pace. And what I advise people, when you get invited for your smear test, you might find it more comfortable to wear loose clothing or like a skirt, for example. You might want to take a paracetamol before going, but it's not a very painful procedure at all, George. It's not. And there are many things the nurses and the doctors can do to help you. We have different sizes of devices we can use to examine you. We use gel to lubricate the instruments we use so it's more comfortable. So 5 minutes of your life every 5 years could literally stop you dying from cervical cancer. So please, my key message is go for your smear test.
Go for your smear test, and I think that is very loud and clear, Dr. Isioma Okolo. I mean, what sort of I think I'm asking this question based on perhaps demographics and also kind of age, and which women is at the highest risk for cervical cancer.
So in general, overall, when we look at all women, it's younger women. So younger women are more likely to be diagnosed with cervical cancer. And so women, I would say in their 30s, I would say late 30s as well. And so other risk factors for cervical cancer are things like smoking. Smoking impacts your body's ability to fight off the virus, so it makes you more vulnerable getting the HPV virus, and less likely to fight it off. It's very important with cervical cancer. So whether or not you are sexually active, so even if you're a virgin, you should go for your smear test. However, if you are in a sexual relationship, you should be using protection and also getting your general screens for general sexually transmitted infections. We don't offer any screening for HPV as a STI, if you see what I mean. It's any kind of screen for cervical cancer. But regardless of that, we should all be engaging. If you are somebody who's sexually active, you should be engaging in safe sex by using condoms and going for regular STI checks for other infections, chlamydia, gonorrhea, HIV, syphilis, and the lot. So we should all be taking responsibility for our sexual health
Yeah,
and
and
go for our
HPV is not
screening.
considered as one of STD tests that can be done
It's not because it's so common. Most of us have been exposed to it
to
at
it.
some point in our lives. And you don't need to have, for example, penetrative intercourse to get HPV. So
Oh,
this
are
is
they?
another thing.
Okay, that's interesting. So you can get
Yes.
HPV by. No, it's not necessary that you have it
I
from
like physically
transmission.
touching, yes, genital touching, that kind of thing. Yeah, so it's
Okay.
very important. In general, we should all be practicing safe sex and things like that. And this is why we don't screen for the virus in STI screens, because it's so common and most of us will fight it off at some point in our lives. A
Yeah.
very small group of people, it will then evolve, will get it, and then it will then become cervical cancer.
Yeah, and just to kind of emphasize on the HPV side before we move on to the next question. So can a man give a woman HPV?
Absolutely, absolutely. And in many parts of the world, so I spoke about the vaccination as the first line of defense. So in
That's
many
right.
parts of the world, boys and girls are being vaccinated. And also, a lot of the times when we are talking about, so HPV affects men and women. Absolutely. And HPV can cause many other types of cancers. So obviously cervical cancer is the commonest one. It can cause oral cancer and throat cancer. It can also cause anal cancer as well. So this is something that affects everybody. So unfortunately at the moment, I guess because of the prevalence of the condition, the screening for HPV is targeted to people who are assigned female at birth. Okay, meaning people who have cervixes at the
Yeah.
moment in the UK. It's not routinely offered to everybody.
It's not routinely. So are there prevention measures? I mean, preventive measures that the women can take, or maybe everyone.
Yeah, so yeah, preventative measures really would be practicing safe sex, really. So using condoms will reduce your chance of exposure to HPV. But even with condoms, it's not 100% effective. Like I said, smoking cessation. So if you smoke, absolutely cut that down because it weakens your immune system. And again, yeah, so that's more the prevention. Again, early detection. So if you notice any, and obviously going for your screening, if you notice any changes in your bleeding, pain after intercourse, you must report this to a GP because there is a stage before cervical cancer. This is the pre-cancer stage, which is treatable. And this is really what we're trying to pick up.
Right.
Do you have HPV or not? And if you have HPV, what is the chance this is going to then lead to the pre-cancer stage? So that screening and early detection can help essentially pick up a group of people who we can treat. This treatment involves various things, taking maybe basically a treatment to the cervix to cut out that area that's impacted can then also prevent you developing cervical cancer. So it's very, very important. Go for your screening. If at your screening anything is picked up, continue to go for the treatments and screens that you're offered.
And finally, is this cervical cancer curable?
So it is. So for a lot of people, when it's picked up in the early stages, you have what's called 4 different stages of cervical cancer. The earliest stages would be stage 1, 2, 3, and a bit of maybe 3.5, right? Once you get to stage 4, the cancer has spread to other parts of the body. Okay. Stage 1 and 2 for many people is curable, and what this would involve for most people would be surgically taking out the uterus, that's the womb and surrounding organs. This is called a hysterectomy. It's a kind of hysterectomy called a radical hysterectomy, which means you take away the womb and some of the other surrounding tissues and organs. And for many people, that is curative. Absolutely curative. Some people will then go on to need additional treatment, whether it's in the form of often radiotherapy, if you do need additional treatment. So the earlier stages of cervical cancer, when it's smaller, when it hasn't spread as much, are more curable. But the key thing we want to do is to prevent people getting cervical cancer, because like I said, no woman and no person assigned female at birth should die of cervical cancer in this day and age, where we have vaccination programs, where we have screening, and Scotland is doing very, very well in the screening program and catching up in the vaccination program. And obviously, I know this is Jambo Radio, so we need to shout out other parts of the world where so for example, Rwanda globally is doing extremely well in the screening program and the vaccination program. So globally, we're making massive strides in making sure, women don't die of this preventable disease. Because in many parts of the world, women survive pregnancy, which can be quite dangerous, only to die of cervical cancer. And like, what a huge tragedy that is.
Yeah.
So thank you for making space and creating this platform so that people know a bit more about their smear test. So when you get your appointment, go for your cervical screening. Don't be scared. 5 minutes of your life could change the rest of your life.
There is nobody more qualified to talk about this than Dr. Isioma Okolo. She's gynecologist, and of course, I think it's very important. The preventive measures are very important. Go for your cervical cancer, for your cervix test, or what? Smear test.
Your cervical smear test. Just say go for your smear test.
Go for your smear test when you get a letter from your GP. And for those of and of course, so Rwanda is making progress on that. What about the black community in Scotland? I mean, you work in Scotland, so how? You mentioned some things about I don't know if it's skeptical or scared of that invasion of privacy, and also. So what do you find?
Yeah, so we find that, so there's actually been some research for ethnic minority communities of understanding what is it that prevents people from going. And this key thing is fear. Maybe your auntie or your sister told you they had a bad experience. Majority of people who go for their smears have a positive experience. There's also, conversation you had with Professor Mukami, MBE earlier. There's also a fear about how people will be treated when they go for their smear test. So I really welcome this new ruling against hate crime, because unfortunately we know institutional racism is one of the reasons why Black people and ethnic minority people engage differently with healthcare, because there's a worry that we will be treated differently. So all these measures that Scotland are moving forward around equality and making sure it is a safe, inclusive environment for everybody will have a positive knock-on effect on Black women and Black people who may be at risk of cervical cancer. So
Wonderful.
It's not that difficult. 5 minutes. And if you feel that you've been treated badly, there are ways that you can escalate these concerns, but do not allow somebody's potential bad treatment ruin the rest of your life. Go for your cervical smear test for 5 minutes. If you're treated badly, I hope you're not. Escalate that appropriately and make sure your sisters, your aunties, your moms all go for their smear test.
Absolutely. Given that 41% of Black women are more likely to develop cervical cancer, and then 75% are more likely to die from it. So it's very important that they can take preventive measures by testing, and of course, do you find that some of the reason why people, perhaps women from the Black community in Scotland are perhaps worried about the experience of someone that they must have heard, that keeps them apart? Is that also aligned with culture, or what do you think that is?
Yeah, so I think that's a very good point, Jordan. I think that's something we have to talk about. There are probably some cultural barriers to screening. Maybe people think perhaps if you are, for example, not sexually active, you don't need to go for your smear test. That's not true. Also, maybe some people have some views around what the smear test actually is doing. There are some people who I've heard express concerns for their daughters taking the vaccination, because they worry that this might encourage promiscuity and the lot. And this is absolutely false. What the vaccination will do will protect your daughters, your aunties, and your mothers from cervical cancer. And what the screening will do is the exact same. So kind of trying to police women's sexuality under the guise of culture, unfortunately, is something within some cultures that also promotes this disparity as well. So it's multifaceted. There's the individual, there's the healthcare professional that they're intersecting with, but there's also the health system that they're operating with. So we need to challenge some myths and taboos within our communities around sexual health. and reproductive health and women's health. Okay. Often we talk about these things in hushed tones. So I love that you've invited me bright and early on Jambo to talk about this. But we all need to be talking about cervical cancer, whether or not you are a woman or assigned female at birth, because as a man or somebody who doesn't have a cervix, your awareness of cervical cancer could help your sister, your mother, your wife, your partner, your auntie. So it's very important. So we need to challenge the kind of taboos within our cultures that the stigma. Maybe if somebody goes for their smear test, it means they're a promiscuous person. Absolutely not. It means they are very responsible and they're taking full control of their health and also the health of their family as well.
And what do you think we can do to contribute in that change of perhaps the taboos to to improve people's knowledge on on this?
Yeah. So there's many things. One, having this on a platform as visible as the radio is one. Two, there's a lot of work going on social media, but there's also a lot of misinformation. So I think we need to think about how we educate people in various platforms, not just in school or classrooms or in when you go to see your GP or your nurse. I think we need to embrace the social media trend, but also be careful because our communities are more vulnerable to misinformation. I always talk about during the pandemic, the WhatsApp aunties. I mean, every day I was getting a message or two. The conspiracy theories from the WhatsApp aunties were like,
above.
I think,
Yes.
But I actually think when you hear myths, right? People's myths about healthcare, as opposed to being like, oh my God, that's so primitive. What are they thinking? I think we should be curious. A myth is a way people make sense of what's going on. So and try to understand why is it that you think that. And actually, when people explain to you how they've come from A to Z, and if there's a barrier in between, that way you're more likely to kind of change their mind, as opposed to just saying, oh no, that's wrong, you shouldn't do this. You need to maybe have these conversations. And also, I work with, as well as being a clinician, I also do community engagement, and I'm a director at CRISA, Women of African Descent. And CRISA has done a lot of work around intergenerational engagement and learning. So I think this is another way we can improve things, because for some people, actually, for women and people with cervixes, we find actually the men in our life are allies and supporting us to do these things, but maybe the judgment and the fear from the women in our lives around some of our behaviors around health is actually a barrier. So we need to also use intergenerational learning in different platforms, online, in person, on social media. Let's target those like WhatsApp auntie groups. Let's infiltrate them with good, informed, evidence-based evidence.
Absolutely, accurate information.
WhatsApp aunties on. Yes, let's invite the WhatsApp aunties on Jambo Radio and have a conversation. Talk me through this. How did you get, Auntie, how did you get from X to Z? Tell me how you did that. And then let's have that conversation.
Absolutely, I think that's a very good suggestion. So we will take I think we'll take up that as well. Dr. Isioma Okolo, thank you very much for coming on. It's always a pleasure, tapping into your brain and and hearing all the good work that you're doing. And we much appreciate you for all that you do. And when you're back in Scotland, let's catch up, and then we can we can take up that idea of maybe for a phone in to have you in the studio and you talk to to have people answer to have people ask you their concerns, and then you can respond, especially on your specialism as a gynecologist, and of course talking on this topic on cervical cancer.
No problem. Thanks, George.